हेलो अस्सलाम वालेकुम यूट्यूब चैनल। तो आज मैं आप लोगों को बताने वाली हूँ थेरापेटिक कम्युनिकेशन के बारे में। A process in which the nurses consults influences or help the client to a better understanding the through the verbal or non-verbal communication. Therapeutic the communications involves the use of specific strategies that encourage the patient to expresses the feelings and ideas that convey the acceptance and respect. Type of therapeutic communications for psychiatric the patients. The more severe the condition can leave a person unable to function in everyday the life. Psychiatric the patient topical they require the long-term therapy in order to address the whatever issues have brought them to this point. Therapeutic the communications encourage patient to work through the unresolved the issues in their lives. Identification है individuals who suffer from the severe the mental disorders may be the admit to a hospital or clinical for treatment. Topical the someone in this condition is unable to carry out the requirement of every day living. The psychological state may involve the extreme paranoma or visual or auditory dilation, meaning the person's grasp on reality is a weak or non-extension. Therapy of someone in these conditions is different than that used for higher the functioning and individuals to be the effective the therapeutic communications must meet that where he is at. इसके फंक्शन है द टाइप ऑफ मेंटल डिसऑर्डर्स encountered in a psychiatric the patients may include the anxiety, conjunctive the malfunctions or bipolar the conditions. It is not uncommon for a person to be suffering from more than one disorders at a time. To provide the right type of therapeutic the treatment, clinicians assesses the psychological state of the patient through a series of tests that provide the information the recording a person's thought process and behavior. Interview are conducted with the patients as well as with the family the members and friends. Psychodynamic therapy. In most cases the long term therapy is a necessary to treat the individual suffering from the chronic the psychiatric condition. Psychodynamic therapy helps patients gain insight on how they are the thinking the patterns affect the quality of life. Therapy the communications focus on how a person's past experience affected his parents behavior. This form of the therapy the attempted to uncover a person's unconscious through the process and motivations, so unresolved issues and can be the confronted and new the coping the skills can be that learned. Conjunctive the behavior therapy. A mental the disorder topical stem from the certain the patterns of thinking. The therapeutic communication used in a conjunctive the behavior therapy focus on the patient's thinking patterns and behaviors. This approach the attempted to uncover the automatic thoughts process data promoting and healthy the emotional and behavior. Automatic thoughts process are made up of pre-formed perceptions and expectations. Individuals and are encouraged to make a connections between their the thinking patterns and their the emotional states. Once this is accomplished, the patients can learn the healthy coping the skills. Psychiatric nurse communications and psychiatric patients. The psychiatric nurse is a members of the multi-professional the mental health team. Utilizes goal directed approaches to assess the psychiatric the patient in mobilizations resources the promoted risk stories and maintains his mental health as an integral part of his comprise the assignment, planning, implementation, evaluations, all four steps of the nursing process, and the nurses interactions with the patients are depending upon therapy the communications therapeutic the communication remaining the importance as the cover of all nurse patients instructions. The aim of his research was to explore and disorder the viewpoint of psychiatric nurse on their the communication and psychiatric patients, and to the formulate guidelines or psychiatric nurse. Such the guidelines should assess the nurse with the communication with psychiatric patients, helping in the resolutions and maintain the face of the patients. Mental health explorations, descriptive and contextual research was done with the purpose of gaining insight into the viewpoint of psychiatric nurse on the communication and psychiatric patients. गैस मेरे वीडियो को लाइक करें, शेयर करें और कमेंट्स करें. थैंक यू सो मच.